Welcome to the grand finale of WitBlox Young Inventor Techfest 2021 organized by IIT Bombay. Let's check out the journey of Vineet Prajapati and Sneha Pandey from Raipur.
Greetings to all. I am Sneha Pandey from 11 Sciences, studying in Bhavan Sarki Shada Vidya Mandir, Raipur.
And I am Vineet Narayan Prajapati. I too study in Bhavan Sarki Shada Vidya Mandir.
And here are my hobbies. The first one is Karkar, which is a classical dance form. And my second hobby is reading books. And right now I am doing a book, Ravan, the enemy of Aryabharta.
Hey there, I'm Vineet and my areas of interest are coding and robotics and performing yogasanas.
Greetings of the day. I am Sneha with my partner Vineet Narayan Prajapati from Bharati Vidya Bhavan Sarki Shada Vidya Mandir, Raipur, here to present our project Detect FM, which is a novel approach to detect FM or fibromyalgia. Here are the headlines of various newspapers related to fibromyalgia. Here you can see how fibromyalgia has grown due to COVID. So then, when we read these newspapers or news headlines, we decided to work on fibromyalgia as our project.
Statistics related to fibromyalgia. In USA, about 4 million adults are suffering from fibromyalgia. This is about 2% of the adult population. Second wave of COVID has spiked the fibromyalgia case. In the whole world, around 3.4% women are suffering from fibromyalgia and 0.5% men are suffering from fibromyalgia. It is a condition characterized by the widespread of the musculoskeletal pain, static conjugative disturbance, psychiatric and multiple somatic symptoms often accompany the disorder. A question on the slide. That's why do the current diagnostic methods fail? Now I will tell you the reason behind this. The first reason is that there is no positive test available to detect fibromyalgia. Secondly, the test which is available right now to detect fibromyalgia is the exclusion test, in which doctors detect multiple musculoskeletal diseases, and if the result is negative, then detect that pain as fibromyalgia, which is a very costly or expensive test.
We are trying to fill a gap between a patient and a orthopedic doctor. When a patient has a pain, he first starts doing the home remedies, and if he is not satisfied by this, he goes to a nearby medical store to buy a painkiller. Even then also he is not satisfied, then he goes to an MBBS doctor for his further treatment. And after this also, if the patient is not satisfied, then only he goes to an orthopedic doctor, which is almost after 6 months of pain for his or her treatment. But till then, the condition of the patient is very bad. According to this, our solution is a machine learning algorithm which calculates relative risk factors and use them to detect fibromyalgia. The relative risk or the risk ratio is the ratio of the probability of an outcome in an exposed group to the probability of an outcome in an unexposed group. So, the algorithm to calculate relative risk factor is based on a conventional method of 2x2 table.
So to detect fibromyalgia, we have sought to have a web app. The web app is made through Flask, and the web app consists of a detailed questionnaire in which each question corresponds to a specific data point and is allocated a relative risk value. So for each positive selection of a data point, the person's risk to fibromyalgia increases. After the person has filled the entire form, he is drawn to a results page. Through this way, we analyze the person's risk to fibromyalgia. We display the person's initial risk on the results page and suggest them if they need to consult an orthopedic. Being the pioneer of proposing a detection toolkit for fibromyalgia, we needed some prospective data to select data points, that is, risk factors associated to fibromyalgia. So we conducted a study involving more than 50 patients with the help of our relatives and some doctors. So in the study, we decided to assess the following data points. After the study, the data collected was fed into a machine learning model to develop a variable importance plot that helped us to decide specific data points that we'll use for the detection of fibromyalgia. Having selected the data point, it was time to calculate the RR values. So we mimicked the algorithm of the conventional technique into a simple Python code. So the RR values hence calculated were age RR1, height RR1.18, sex RR0.19, the proliferation of tender point RR0.20, associated disease RR0.41, concentration of cytokines RR0.66, work duration RR1.06, accident RR0.55, posture RR1.12, rest RR0.82. Restrictions due to COVID-19 pandemic curtailed our reach for conducting a large-scale study. However, being freed now, we aim to conduct a large-scale study that will help us to develop a significant p-value. For conducting the large-scale study, we hold current traction with the Vodhe Hospital, Shri Balaji Hospital, AIIMS Raipur and Dr. Bhimrao Ambedkar Hospital. We also got a LOR from AIIMS Raipur for our endeavor. Through the project, we have been in constant touch with professionals in the field of medical sciences, who are Dr. Krishnadat Chavli from AIIMS Raipur, Dr. Namita Srivastav from Pandit GLM College Raipur, Dr. Raman Srivastav, who is an orthopedic surgeon, and Dr. Santosh Saur, who is also an orthopedic surgeon. They have helped us along our way with their valuable advices that have brought virtue to our project. Artificial intelligence is penetrating into every facet of our life. Artificial intelligence has also marked its presence in the healthcare sector. Google's automated technology of using a smartphone to detect diabetic retinopathy and glaucoma accurately is evident of the same. Our project is also such an endeavor. It acts like a boon to the clinical etiology of fibromyalgia. Fibromyalgia, a wide term given to the unclassified pain in our body. The research to classify fibromyalgia as a disease is a matter of concern. Firstly, fibromyalgia was sought to be treated by a rheumatologist. Later, some arguments came up and it was then considered as an orthopedic syndrome. And latest discoveries suggest that fibromyalgia is an autoimmune disease. This gradation in the research of fibromyalgia speaks that fibromyalgia is a weak disease. Our innovation comes up here. Our method of conducting a study and using the collected data to analyze and calculate the relative risk factors and henceforth proposing a detection toolkit for a vague disease is very efficient in diagnosing vague diseases such as fibromyalgia. And therefore, we are not just developing a detection toolkit for fibromyalgia but also proposing a method of curating detection toolkit for other vague diseases that are harming the mankind.
Project is that our study is novel, as there is no study till now which tell us about the relative risk factors of fibromyalgia. The previous methods to detect fibromyalgia uses blood, which is an invasive procedure, whereas our procedure requires data or information which is totally non-invasive. Secondly, the previous methods or the current diagnostic methods are of high cost, whereas our is free of cost, as it is an app. The current methods were not able to distinguish between fibromyalgia and other associated diseases, whereas our web is easily able to do so. So I would like to conclude with saying we have tried to make a cheap, non-invasive and highly efficient method to detect fibromyalgia with relative risk factor, which is a machine learning algorithm. This novelty will be a boon to medical etiology and modern diagnostics.